Isang ligtas at malusog na umaga, OSH advocates. Welcome to Plenary 1 of the 17th National Occupational Safety and Health Congress. This plenary session is about innovations in OSH governance. To talk about governance in the new world of work amidst and beyond the COVID-19 pandemic, we have the Assistant Secretary and Concurrent Director 4 of the Bureau of Working Conditions of the Department of Labor and Employment and the former Executive Director of the Occupational Safety and Health Center, Dr. Maria Teresita S. Cucueco.
Noel Binag, Commissioner Ecop, Commissioner Sergio Ortiz Luis, Commissioner Roble, to all our colleagues in safety and health, for my colleagues in the DOLE, I think Asec Benjo Benavides is here as well as ED Stella, and to all my friends who in safety and health, good morning, and thank you for inviting us to share with you our this session on innovations and how the DOLE has handled, and it continues to handle all the challenges, both in safety and health and other concerns related to the pandemic. Can I share my screen? Or kayo na po ang mag-ano? Okay. You will be the one to kayo na? Kayo na po ang, will you be, or shares? Okay. Sige, wait lang po. Okay, can we have the next slide po? Good, hello, yes. Okay. When the pandemic hit, during that time, actually, we had COVID as early as 2019. In January, we already started having the cases. But you know, when it also happened, we had another crisis as well. We had the Taal eruption. And it also, of course, the DOLE had to provide the necessary services to those affected. Why am I also going back to that? Because sunod-sunod ho ang mga disasters that happened, and the DOLE really had to put up and had to respond immediately, efficiently, and effectively. With the leadership of the Secretary as well as other officials of the DOLE, we had to bring in all efforts. It was DOLE together with the whole of society and whole of government. With the pandemic, we knew it could not just be DOLE alone. That was why the whole of society approach had to happen. Next slide, please. And there are very many important, as you look at this slide, you will see these pillars of action. Before kasi medyo blurred po yung lumalabas sa slides. Can we have it any clearer so that you can also really see? Because on my end, I'm not just sure if you have clearer slides from your I'm sorry, I need to ask, or can you allow me to share my screen? Please allow me to share my screen po so that siguro I can also, everything is blurred po. And even I am blurred as I see myself, which is not important anyway. May I be allowed to share my screen, Secretariat, sir? Thank you. Okay, is this clearer na po? I hope it is clearer. So here, like I said, the whole of society. And now here, you have to understand that the DOLE really had to put in place immediately actions and interventions. Jobs were lost. The pandemic created such a big havoc on everyone's lives. We know that. We had to stop work because being together meant passing on the virus, and we had just had to stop that transmission. And that was why the quarantines, you had the ECQ, we're now moved to another level. But then that was one of the most important actions that had to be done. And because it had to be done, how would we support workers? That was a big and a major problem. And there were still segments of society, the essential services, that had to operate. And they had to operate safely. Otherwise, we will end up with more workers who were sick with their safety and health issues, and we did not want that to happen. So we had to look at all of that, and it is really looking into policies, what else had to be given so that social protection can continue to be given. At the beginning of the pandemic, we were telling employers, can you already give the 13th month pay? Because really there were workers who were not allowed to go to work. And for those who were allowed to work, we had to immediately look into guidelines that would look at what our national DOH was saying on strengthening the minimum public health standards. It had to be translated into concrete activities in the workplace. We also had to listen to the workers and also see that they had concerns. Like even if they had to go to work, there were those who had to be frequently tested. There were those who had quarantines because they were close contacts. How were they paid? All of this, the DOLE had to also look into so that they can be provided the necessary actions, interventions to provide that relief. So taking into account where the strength of the department, we knew that policy formation was vital, but the policy will really have to come from a consensus. We have the tripartite, and even before that, we had to also listen to the whole of government, the IATF. In this pandemic, it was really a response provided from the whole of government, then down to workplaces where the employers, the workers had to be consulted. And because there were new policies, advocacies had to happen immediately, information dissemination, capacity building. And one of the major key strategies of DOLE to ensure that workplaces were really following these standards was really to ensure that enforcement and inspection would happen. So again, this just shows you the whole of government. We had to work with the DOH, the DTI, the DILG, and our other civil society partners, including the Safety and Health Network, where your role was so highlighted because of what you are supposed to be watching out for, to be monitoring, to be reporting in workplaces. So as early as April of last year, the DOLE and DTI already provided the interim guidelines. And following the months after that, we knew we already had more information about COVID. And then the DOLE then issued the following guidelines following this interim, the DTI DOLE 20-04A, which is more extensive, but still looking at the necessary safety and health measures on increasing physical and mental resilience, noting that mental health is one of the biggest issues now. And then, of course, we are looking at COVID and looking at all the preventive strategies, reducing transmission, minimizing contact rate, reducing risk of infection. And as you go on and you see this next slide, from all of this, we had to further provide other policy issuances so that we are going to address the mental health, ventilation, when it was already proven that the airborne transmission was there. The DOLE brought out DO 208, if I'm not, no, that was DO 224 of this year on the ventilation standards. And aside from that, because workers had to go back to work, and there were also the need for companies to ensure that there will still be more workers who can still continue work, we had the flexible work arrangement policies on the PPEs, on the cost, so that it is not going to be borne by the workers. But of course, the employers would have to bear these costs, what the benefits and entitlements are. The safety officer and the Safety and Health Committee, in all the guidelines, even in the IATF, you will always repeatedly hear the safety officer being an important focal person to monitor, to ensure that protocols are followed. So I do hope you understand that big responsibility, especially now. Then we also brought out the vaccination program policy, the labor advisory that highly encourages vaccination. But like the secretary said, we are still not allowing the no work, no vaccination policy. We do encourage, but because the national guidelines also say that the vaccination card is not mandatory for employment, then we have to align ourselves with that as well. Then, of course, there were other policy issuances like the contactless transaction, other issuances on contact tracing, and following that, what other innovative strategies so that everything will be done online. We had the COVID, the safety seal, and you will see the other programs of the DOLE that is now purely online. So we know that with COVID, technology is a major pillar that we will have to use. We know that it was going to be the system where we can transact business, where we can safely transact business, safely do our activities, so that there will be no further contact, there will be no face-to-face interruption where the possibility of transmission may happen. And it just so happened that we had this already. It was so fortunate that at that point for the DOLE, the necessary backbone for these online services was already present, and we just had to accelerate these technology for better practices. So what did we have? We had the Labor Inspection Management Information System, the MIS. Before COVID, this was really, it continued to evolve and we're not saying it's perfect, but at least it was really working very well, because that inspection system was always, our inspection has always been subject to so much questions about is it true? That's why this online system had to be done so that as soon as the findings were done by the inspector, this was pre-COVID, they will send it to the regional offices and they will send it to the bureau as the findings, so that there is no, that question of are they tampering? Because there was a time frame that they had to submit it right away. And that was why that online system where we had all this information had to be given to us within 3 days was already one of the major backbones or the pillars of strength in providing the necessary technology, where now we continue to develop this joint monitoring system, the checklist. That's why you see it there. All the inspectors, we still had to continue doing not virtual inspection, but physical, because there were questions on virtual inspection. And as you see the numbers, this was really done physically. But, if COVID will, and the variants will be more severe, we are also exploring the possibility of having such virtual inspections, but done properly so that everything will be validated. So what did we see in terms of inspection? We did not stop inspection. It continues. It continues. It's continued in 2020. It continues now. And we had 3 types of checklists, and you see it here. But on cumulative establishments covered from January up to now, we have 77,695. But you see the first thing with the different colors. These were checklists that had to be done by our inspectors. When we say it's complete inspection, it is with labor inspection, the general labor standards, wages, hours of work, benefits, the OSH, and other monitoring inspection also that had to be done. Then there is labor inspection only, which is the general labor standards and the safety and health. Remember, pre-COVID, we already had DOLE 198, and that is why that OSH checklist was also vital. And then we had the OSH COVID-19 checklist, which was really monitoring for the DOLE DTI guidelines. And it was, in the beginning, we wanted the full complete inspection, which is labor inspection as well as COVID, that was covered by 34,000. However, when there were also those that just, there were some regions that did the GLS and OSH only. And during the surge, when the IATF asked the DOLE to ramp up inspection for the monitoring, you will see that's why it was just for the COVID monitoring. But all in all, if we look at the total number of establishments that were inspected, it was 77,695. There were compliance rates. It has improved from the previous, and we are very happy to note that the safety and health really has improved because of knowing the value of having good complying with all of these monitoring indicators. So these are the top violations from the OSHS checklist. You will see that first aider, you will see that, and this is why I am very grateful for both the Secretary and ED Binag that they are ramping up also the safety officers that are needed in companies, because we see this as a top violation. First aid, we hear you, we know that the first aid training has been, it has been stalled, or it's very limited, but very soon the center will also come out with this. Then you see the others, the non-registration. That's why we are slowly building up that this will all happen online. And for COVID monitoring, the non-submission of the COVID-19 WAIR, we have already many, but we know it is still lacking. There's also another violation on the minimum health protocols. It's not ensured by the safety officer, perhaps because there's no safety officer, and that is why we really need the safety officer. And we also see that you note the non-enforcement of the OSH program by an OSH committee, because you note that it is also not present. But then you also have those compliances, making sure that the IATF guidelines on physical presence is complied. You don't have to be present. You can do virtual. These are all parts of the compliances that is being done by companies. Following this MIS, we had to have for the DOLE support for workers who were displaced. And from our MIS, we built this establishment reporting system. So it became, online. They just submit online that they will be closed. These were the workers who will be affected. Then they will have the necessary, as long as all documents are complete, they will have the necessary approval so that they can continue and it can be provided, the TUPAD, the camp, all of these financial assistance done online through the regions, you will see that it was happening online. And it did not need that you had to go to the offices. But of course, the need that they will be getting those financial assistance in the remittance centers, that would still have to be physical, but that was already just that limitation for that physical. Otherwise, everything was done online. Then we have the eSena, which is the single entry approach for conciliation. We are also starting to do this online so that you don't have to have face-to-face interaction with the with the mediators, and you can proceed with the necessary actions to be done. In all of this, you see here the different flexible work arrangements. What you see here were all of those that were reported online. Because if you see those who had closed, those who were affected, that is why the DOLE was reporting weekly to Malacanang and to the President. And we were able to do that because it was an online reporting system from the employers telling us on the number of workers who are affected, and the DOLE providing the assistance. Again, these were all done online. So all of these innovations had to happen, and it had to happen quickly. But we were very fortunate that a backbone was present. And that was why we immediately were able to provide the necessary processes, improving the process cycle time, reducing waiting time, that it was contactless, because we're talking of transactions that we avoided face-to-face and the possibility of having COVID infections. And we were also talking of now we are talking of other frontline services that we are developing. And namely, these are the two that we want to put up front for very soon. Registration, which is online of all establishments under the Safety and Health Standards 1020, and the Construction Safety and Health Program application. So these are things, these are key frontline services that we are now developing. Before COVID, we had this energy virtual one-stop shop. There was a Republic Act which established this, the EVOS. This is very important because power generation also remains one of the crucial key generating activities for government. It is crucial because it is ensuring that we have the necessary power, the power needed to do business, to transact, and that EVOS, this Republic Act made sure that we are going to do this in a very efficient and effective way. It also made sure that it is virtual. When we saw this at first, we were really, it was a hard, we had to look at it well, and we had to see, because starting from the construction safety and health program, going into the plans that had to be submitted, it would be blended, but the application will be online. And there was process cycle time that had to be ensured. This law was not, was not bending on, if you don't do this, you will have the necessary sanctions to the government offices that will not do it in the process cycle time. It was a challenge, but we have done this, and it even continues all the way. It is a closed system, even to the permit to operate. It is already there. We are now together with the DOE, the platforms are being arranged so that when we roll it out to the stakeholders, you just have to do all this online submission. Mechanical plans will still be submitted. That will stop like the online system for a while, but once brought back, then continuing again on the process cycle time. So this is this again is another online innovative tool, but making sure that we are looking at activities in government, in the whole, in our whole nation, where power generation will be ensured. The COVID report is now online, and you see the numbers that we have. 57,000 establishments have submitted their WAIR, and these 57 had 8 million workers, and from this, we saw that there were now 33,000 workers in these establishments confirmed. These are just numbers. Remember, we also at our back was the National Privacy Commission, making sure that your privacy is also kept and secured. What we just needed were numbers so that we can address companies that needed perhaps further guidance and support. So we continue with our e-learning platforms. We even for our inspectors training course, they are now of course done online. We also have other issuances via teleconferencing. Usually during the rollout of our policy issuances, we do this online. You can also request for it, but as we go, we now just wait for requests. But we are also we have put on the necessary e-learning infographics and videos in our website. And the safety seal. Okay, that safety seal is, I think all of you know it. This is, again, another whole of government. It is not just the DOLE. This is with the OSH, DOLE, DTI, DOT, as well as I think the DOTR will come in. And this is a safety seal. This is a display. This is a label that companies will stick on, and these are establishments that have been inspected and compliant to the minimum public health standards. They have the necessary contact tracing. They have the necessary compliances too in terms of the registration of the establishments to the LGUs. All of the submission is online. Again, in our MIS system, that was the backbone, which we already now incorporated this safety seal, so that for the inspectors doing this, you will see that again, these are all being done, but except for the inspection. Inspection is still physical inspection. I am not sure if our other partners in the sector like TTI or even DOT have moved to a virtual type of inspection for the safety seal. For the DOLE, kasi if you see a safety seal, DOLE only has its responsibility for manufacturing, construction, utilities, information, warehouse, and I think now because it has been signed for BPOs. So what do we see in terms of the future of work? There is a lot because technology, again, still plays a big role. Technology also becomes a challenge, and technology is also a problem. The gig economy has, automated systems. How can we look at managers who are in an, automated and looking at how they can also provide where are we in terms of the safety and health for this gig economy? This is almost like an informal sector. It is so difficult, of course, to look at, but it is what is existing now. This is the economy that is continuing and that is thriving. We have the Grab, we have Shopee, but there is safety and health concerns here as well. These are the drivers who go out at any time of the day. Do they have the proper road safety instructions? Do they know? And how are they dealing with the clients who are difficult, clients who suddenly do not pay, the pressures of this work? Again, these are also safety and health concerns that we have to address. And we have to continue updating our skills. I hope you are there also to help us here. That your personnel for safety and health it's going to be very vital. You will also have, together with, in this economy, perhaps the use of robotics. And you will be working side by side. Human-machine interface will be one of these challenges. How are we going to deal with that? So we need all the necessary information. We also need to be updated, and we continue to work with you as leaders of industry to help us in addressing this. So I think, yes, we are looking at new forms of work, as has been mentioned by even the Secretary, the gig economy. Collaborative efforts will really be the best way to go because we have to listen to where, what the concerns are. It will never be from just government alone. We have to continue to upskill our workers. We have to, of course, ensure that employment continues. We have to communicate OSH effectively. And we know the value of complying with all of these safety and health standards, the minimum public health protocols, because they are essential for the lives of the workers we serve. So I think this ends my slide. Again, thank you for inviting the DOLE and sharing with you our innovations, our continuing innovations. We hope you stay with us as we also continue in this path of providing the necessary safety and health for workers for our future generation. Thank you very much. I'll stop sharing my screen.
Thank you, Assistant Secretary Cucueco.